Most gastrointestinal conditions have very similar underlying causes. And what we do in modern healthcare is that we have a diagnosis for everything. And then the diagnosis triggers a CPT code, and then the CPT code triggers a medication or some form of treatment. And I want to try to bring back a paradigm in understanding that this is a very complex process. It has a very, very difficult job to do. And I want to talk about the job, how it functions, so that we all are making better choices in what we're doing and what we're putting into our mouths and the stress that we're under and those types of things. And people will come in and say, I've been diagnosed with Crohn's, or I've been diagnosed with IBS, or I've been diagnosed with whatever. I don't care. I don't care what you've been diagnosed, because I want to know why you have it. The diagnosis doesn't tell me anything other than you have inflammation, you have constipation, you have whatever the symptom might be. What I want to know, are you digesting and absorbing your nutrients? Do you have intestinal permeability? How well is your gut deciding what's going to go into the blood supply and keeping the bad guys in? Is the microbe, the healthy bacteria, well in your gut? You should have roughly 4 inches of healthy bacteria inside the lining of your GI tract, all through the whole lining. And I'm going to tell you, most people don't. How is the immune function and the inflammation going in the gut? This is what we're assessing. And how is the nervous system? Is your gut contracting and relaxing? These are the cornerstones for every condition of gastrointestinal that we have. Okay? You have to look at these 5 things to determine what's wrong with any condition you're diagnosed with. If you don't look at these, you're not going to get to the root cause of the problem. And inflammation is the cornerstone of almost every gastrointestinal condition we have. And so we've got to talk about inflammation in a way that we have a better understanding of how to get it under control. So 90% of the time, the immune system inside the gut isn't supposed to respond because we're eating an apple, we're eating some kind of protein, we're eating something that it's supposed to digest and move in. I always tell people the small intestine is like that old shag carpet we had in the 60s and 70s. It was orange and green and all of that. That's what it looks like inside. This shag carpet helps us digest. There's bacteria and things inside there, good healthy bacteria that are supposed to be there that help us digest our food. This is what happens when the intestinal permeability starts shifting. When we start getting gaps in here, pretty much everything gets through. And these are the clinical conditions, or a few of the clinical conditions, that start happening when you have leaky gut or you have permeability. You have things getting into your blood supply that shouldn't be there. And so are gut problems just gut problems? When people come in and say, oh, somebody diagnosed me with a leaky gut, and I said, yeah, and what are your condition symptoms? Having an imbalance in microbes in the gut will cause all of these issues. And you can see many of these things: diarrhea, celiac, gastroenteritis, IBD. A lot of gastrointestinal conditions are because the gut is out of balance. The best thing that you can do for your gut is to eat healthy and well. And a diet is a way of life. I mean, you have to choose it. It's not something that you can do once in a while. It's something you got to do 80 to 90% of the time. When you're eating a bad diet, you're not going to have healthy. And when you're eating foods that are prepackaged and they're devoid of nutrients, and when we're feeding our kids these prepackaged foods, they don't have any nutrition in them. And so you have to understand that by keeping a diary and understanding what you're eating and things that are flaring your gut up, it will really help you understand what's healthy for you.